Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Newspart interlude. This audio podcast is part of a Storm and Squala. This audio podcast as part of a Storm Robotics production. In this audio podcast, sort of a look at sort of a an excerpt, if you an excerpt from peer-reviewed and published works from 2019, and looking at sort of and looking at works looking at works in regard to regards to the use of social media, mainstream media, to prompt organ donation, transplant education, as sort of a scientist's perspective on chronic kidney disease, or CKD. So as part of this interlude, I look at sort of an excerpt from the peer-reviewed and published works. So using social media perhaps has several gains compared to traditional forms of mainstream media where healthcare education is concerned, but both have advantages with regards to reach and accessibility accessibility and prompting organ donation and transplantation education. And so in relating into health literacy, in relating health literacy is also pivotal, thus bridging gaps in understanding of specific areas of health. And this is where healthcare scientists also have an important role to provide health science transparency with other health professionals, where other health professionals are challenged. Clarity of terminology to help increase health literacy on topics relating to organ donation and transplantation is now or are now especially required, owing to the public, owing to where the public spend more time online, and using social media versus mainstream media to provide broader education surrounding organ donation and transplantation is still unique. However, healthcare scientists could seek opportunities, or healthcare scientists should seek opportunities, or sort to identify opportunity to help raise more education surrounding this topic in amongst sort of a in amongst them where faith populations are concerned. And sort of in regards to the peer-reviewed works, listeners, the publication does have sort of a look at particular aims and objectives, and as part of this audio podcast, there will be a particular citation where in on social media, where listeners are more than welcome to identify the publication, to go through different aspects of the works, different aspects of the sort of aims and objectives. Sort of in sort of summary, as part of this news part interlude, practice and research now need to identify novel ways to deliver sort of the education in amongst sensitive topics. Healthcare scientists could help or should help provide education through social media, mainstream media, and for example, the RPSG, the Renal Patient Support Group, is perhaps, or has been perhaps, one of the sort of best examples best example or novel examples through social media where shared decision can become a more shared decisions can become more informed, and where real life stories are being shared. That draws this audio podcast to a close. This audio podcast as part of a Newspart interlude. This audio podcast as part of a Ztorm and Squala. This audio podcast as part of a Ztorm Logistics production.